Hello, everyone. I hope now the slides are working. Welcome back to already session 8 of our European Climate Resilient Health Systems course. And today's topic is measuring, monitoring, and evaluating health systems resilience. I am not going through the course objectives again because I'm pretty sure we're all old hands at this now, and this whole introduction thing today will be pretty short. It will be Marie and I guiding you through the course again. And as you can see here, we are already on session 8. So today and then 2 more sessions to go. And I think so far it has been fun. It's great to see so many of you back. I hope you're enjoying it and learning a lot. Our learning objectives today. We are looking at the definition of a climate resilient health system and at low carbon and carbon neutral health systems. We're also looking at describing the current indicators for measuring the climate resilience of health systems, as well as the areas of focus for monitoring and evaluation of climate resilient health facilities. In detail, financing, health workforce, service delivery, essential medical products and technologies, health information system, leadership and governance, and health emergency planning. As usual, a quick run through the logistics. You know this by now. It's a 90-minute session. We'll have an expert lecture and 2 case study presentations. We will have a question and answer session. We'll try to get in as many of your questions as possible. And please make sure to put your questions in the Q&A box, not in the chat, because the chat is so incredibly busy. As usual, also the recording, slide decks, and everything will be made available on the website. Your attendance is automatically recorded. So please make sure you stick with the Zoom link you receive. You have to use your own personal Zoom link, otherwise your attendance won't be counted. And again, the certificate of participation will only be awarded if you attend more than 70 or more % of the live sessions with your personal Zoom link and pass the final exam with a score of 70 or more. And again, make sure to use the correct link. And I think that is all for now. And I will pass over to Marie to start introducing our really, really interesting presenters for today.
Hello, everyone. So thank you, Kirsten. I'm Marie. So our first presenter today is Professor Andrea Schmidt, and then we will have 2 case studies from Kim van Dalen and Alina Timotin. Andrea Schmidt is the head of Department of Climate Resilience and One Health at the Competence Centers for Climate and Health at the Austrian National Public Health Institute. She works at the interface of research, policy, practice, and is currently focusing on topics such as climate resilience of health systems, climate-smart health workforce, and socio-ecological transformation in long-term care. She is also a consultant and a technical expert for the World Health Organization on health information systems, long-term care, as well as in the WHO-hosted network Alliance for Transformative Action on Climate and Health. So I'll leave the floor to Andrea to start with the lecture.
Thank you very much and welcome to everyone. I already saw so many countries in the chat, which is really nice. So good morning or good evening from wherever you are at the moment. And I also have some slides prepared so that it might be also a bit easier to follow what I'm saying. And I will also ask you to participate at some points with active participation in the chat. So really welcome also to hear from you. So the topic for today, and I know that you've already had 7 sessions, really interesting sessions in this course. And the topic for today refers to measuring, monitoring, and evaluating health systems resilience. Now, that is a quite big topic, I must say. And as you will see, it's also it's not easy to give you just a handbook of how to measure, monitor, and evaluate, but I will give you some tools and some ideas on which perspectives you can take when you do that. And you already heard about the session overview, so I'm not going to repeat that. And also, of course, in the previous sessions, you've worked with the WHO framework, so I also don't need to introduce that too much, but maybe just for you to remind you all the different sessions that you've already heard, they referred to several parts of the WHO framework, of this colorful cake, as I sometimes call it. And today we are going back again to the full picture, so to say. So we're not focusing on some pieces of the cake, but really on the full picture. But at the same time, we will also dig deeper into some of the parts of the cake that you may not have looked into so much yet. And this is a short overview of what you can expect. Very briefly, some definitions and concepts, just to repeat, and the WHO framework. And then we will move on to what indicators actually are and how we can use them in the context of climate resilient health systems. So you've heard already the definition of climate resilient and low carbon health systems, of course.
Sorry, Andrea.
Yes.
We are not seeing your slides.
You're not seeing the slides. Okay, I'm sorry about that.
You forgot to share.
Yeah, I tried to, but apparently it didn't work. So thank you so much for telling me.
Thank you. Perfect.
Can you see now the presentation?
Yes.
Oh, okay. Sorry about that. Okay, all right. So, yeah, so of course, so I'm going back here, which is the cake, as you know, the full cake of climate resilience, all the 10 dimensions on climate resilience in health systems. And now we're moving to the definitions and concepts. And while you've heard already a lot about the different, well, you've already know the definition of what is a climate resilient health system, because you're already advanced in the course, I would like to highlight a couple of things here. So let's read again the definition. Climate resilient and low carbon health systems are those capable of anticipating, responding to, coping with, recovering from, and adapting to climate-related shocks and stress, while minimizing greenhouse gas emissions and other negative environmental impacts to deliver quality care and protect the health and well-being of present and future generations. Now, if we look in the picture, if we look at this in the picture, you also know this probably already, but I would really like to highlight one part here. So you can see here on the right side that a climate-resilient health system that faces a shock, this could be a shock, but it could be also chronic stress that hits on a climate resilient health system, on a health system. And the question is, how do we manage to move back up? In physics, its resilience is really going back to the original state. Now, when we talk about climate resilience, and it's also according to the International Panel of Climate Change, there's one word here, and that word is transform. Because the transformation is really what also involves the opportunities that we have when we talk about climate resilience, and also the need for reducing greenhouse gas emissions, so that we're not just adapting and going back to the original state, but really making an effort. Where do we have to transform our systems and build them back in a better way than before? And that includes not just avoiding maladaptation, but really thinking about what can be sustainable improvements in population health. And we will go back to this transformation aspect later when we discuss the indicators. And the International Panel on Climate Change talks about climate resilient in a very similar way. And they also highlight these different, as you can see here, these different pathways. So we have a lot of possibilities and entry points at which we can decide to become more climate resilient in our health systems, but also in our societies. And I like this graph because it also involves this green path that goes up. And it shows us that we can have the vision of a better society, of a better health system, and of, for example, higher well-being, lower poverty, ecosystem health, equity and justice. So the climate resilience concept really involves this transformation part. I'm now moving on, and this is a graph on what this could look like. So we are really moving away from negative impacts on our health, but really trying to do something both for our health and for our climate. And I'm now moving on to the framework, and I know that you've already dealt with it, so I will be very short on this. And you know that there are 10 dimensions. And why is this important? It's important because we need the collaboration of all levels in and of all building blocks in the health system when we talk about climate resilience. And what I would like to share here, because I know that you've dealt with this before, is also that climate resilience is also a very good example of how we can align the overall vision of our societies. If you think about all the different sustainable development goals, what they include, but also the UN Geneva Charter for well-being. So it includes really a better life for everyone and more equitable societies. So that's something that we need to consider. It's not only about technical issues of building hospitals, for example, or other technical issues, but it's really about making it possible that there is an equitable and transformed outcome at the end. And that sounds easier said than done, of course. And when we have such a vision, it's also important that we can, to a certain extent, measure these outcomes. And what we can do here is we can use indicators. Now, I would like to know from you, and I really ask you to put this in the chat, what do you think, why do we need indicators? What could be the objective or the purpose of using indicators in the context of creating a climate resilient, a low carbon and carbon neutral health system? You are very much invited to put this in the chat. So I can see you're ready to keep track of your progress, measure performance, benchmarking, measure effectiveness of interventions, make it real, achieve our targets, accountability, impact, follow change over time, metrics, future planning, piloting, funding. Okay, so we need evidence to measure our performance over time, more transparency. And I also heard that some of you talked about funding, which could be important to really give evidence of what we have achieved. Saving resources, I can see here, forecasting to know what to expect. Okay, thank you. And I know that you've dealt already, for example, with the topic of health risks of sustainable health systems. So I know that you've already dealt with a lot of indicators. Now, if we look at what indicators can do for us in the general literature, it's usually, and it's also in the Lancet Countdown that Kim is going to present to you afterwards, the indicators are measurable variables used to assess and monitor particular conditions or trends over time. So you really very much said these things, so you were very right, of course. And in the context of climate change and health, this can be assessing impacts, can be informing policy and decision-making, but it can be also monitoring progress in evaluating interventions. So all the things that you mentioned were, of course, correct. Now, what I notice often when we work on indicators, and I do this as was presented at the beginning, I work at a national public health institute in Austria. And what we do here is we also build up the topic of climate resilience and health systems. And what we hear many times is really, what does climate resilience mean? Why do we need it? And the difficulty is often that we need indicators from a lot of different areas, and often we may not have access to the data needed to actually measure it. And so it helps to define a certain area for which we then use these indicators. But often also people tend to mix up indicators with actions. So as we heard, indicators are measurable variables used to track progress, assess effectiveness, and evaluate impact. And they provide quantifiable evidence. So we can count what comes out of an indicator. And that can be structural, process-based, or outcome-based, as we will hear in a minute again. We will get back to this. Whereas actions are specific steps or interventions, so what I'm doing to achieve a goal, and that, of course, is linked to the indicator, because in the end, it will increase the value of my indicator. So actions are activities implemented by stakeholders, and often, for example, could be in the area of adaptation, mitigation, preparedness, response, or recovery, whereas the indicators are how we measure the success or the impact of these actions. So they're linked, but they're not the same. And I think when we hear it like this, we think it's logical, but sometimes when we talk about specific areas, it can be a bit more tricky. And one of the key messages for me of this lecture is that you also take into account that there are different areas of indicators. And I sometimes miss that in current categorizations when we talk about climate resilience indicators. So I think it's maybe something that we can also discuss later, or we will probably hear also from the case studies a little bit about different approaches to this. But on the one hand, we have structures. So we have factors that refer to, for example, facilities, the equipment, or the human resources. These are more, if you want, the preconditions for climate resilience. What do we actually need to start? Then we have processes that refer to processes of diagnosis, of treatment, and then we have outcomes. And as you will see, the outcomes are still quite weak when we talk about climate resilience, unless you talk about greenhouse gas emission reductions. But apart from that, it's often not very clear what is actually the main outcome that we are aiming for. But I would be really happy also to hear from the case studies then what you think about this and whether you have a different view here. But the outcome is really, what do we want to achieve? What do we want to have at the end? For example, better population health, better planetary health. And then the question is, how can we measure it and link it to the actions that we are taking? And another concept that is important here is that indicators are important in the context of the so-called public health action cycle. So I've seen that you work in different countries across the globe, and I feel very honored that you're joining today on this lecture from everywhere. And so you, in your specific countries, in your national contexts, in your local contexts, you will have policies that are being developed, policies that refer to the health system. And these then need to be implemented, but then the action is taken, but then it needs to be evaluated. And for the evaluation, as you also mentioned, we need indicators so that we can then assess our actions and develop the policy further. So the most important arrow here is, if you like, the arrow from the assessment to the policy development. So the indicators will help us also further develop policies, but also other measures. And just to give you one example here, but we will hear more examples later, emergency preparedness and response. So we have here a structural indicator, the percentage of health facilities with a climate-related emergency response plan. but also then the number of healthcare workers that are trained in climate-related disaster responses. Again, a structural indicator that refers also to a process. So here I would say it's a mix between a structural and a process indicator. And then the action would be the training of healthcare workers on responding to climate-induced health emergencies or the development of emergency preparedness plans for heat waves, floods, and storms. So this is just one example. And as we will hear later, the Lancet Countdown tracks 42 indicators to assess the negative impacts of climate change on human health. And I really look forward also to Kim's presentation here. And you can see that there are already a number of indicators that will be really interesting to hear about. Now, I would like to use the rest of the presentation to focus on areas of focus, some selected areas of focus for monitoring and evaluating health systems, and work together with you on how we can define indicators, but also what we can do with these indicators depending on our perspectives within the health system. And I'm sure you've seen already this graph. Now, what is important here is we have climate change impacting on health and health risks. We know that the risk is composed of vulnerability, of the hazard, of exposure, and then here we have in the middle health system action. So we can actually do something to increase resilience and reduce greenhouse gas emission. And the question is, what actually needs to be done to reduce the impact of climate change on health outcomes, but also on health systems and facilities? And these are the indicators that I'm going to discuss with you. And now, maybe as a bit of a surprise, I'm not going to share with you maybe the classical indicators, but really I want to share with you 3 of the key principles that are important when it comes to linking these health risks with health outcomes. 3 principles. The first one, is my health system able to manage climate-related health risks? And that refers not only to acute events, acute shocks such as a heat wave, a flooding, but really to manage the chronic stress that comes with climate change. And that's, of course, again, linked to monitoring systems, to being able to actually see what is coming. That's the first, managing risks. The second one is also a really important one, which is about capacity. The overall capacity of our health system determines whether or not we have a climate resilient development. And the third one, a long-term vision and adaptive management. And when we talk about capacity, it's really important to think not only about the classical indicators of climate resilience, but really to think about health system capacity indicators as a whole. I'm taking here the example of financing. If you look at this, you can see that, and these are OECD countries mainly. So we see that the health expenditure as a share of the gross domestic product ranges from 2.9% up to 16.6% of GDP. Now, if you think which country will be better able to build a climate resilient, low carbon development, it's quite likely that it's the countries that are overall already spending more. Not always, but it's to a large extent, it determines also how well our systems are able to respond and mitigate climate change. So I think that's something really to keep in mind when we talk about indicators, that it's not only about indicators that refer in a classic sense to climate resilience. And in the WHO publication, you can find these 2 beautiful figures, which I really like. And let's focus first on the left figure. So because it shows us also how the overall health system, the quality and the equity within our health system protects us against climate risks, and including those affected by climate change. So we have here, we have the green dots, these are the high income countries, and the red dots, these are the low sorry, these are countries with lower capacity. And so we can see that in the health system performance index, which where we use the overall capacity of which gives us an overall level of the performance of the health system. So the higher your country is here, the better it performs on the health system overall. And we can see that there is a link with greenhouse gas emissions, but it's not a very straightforward relation. So I think it would be quite interesting also to look into how this relationship can actually be defined. If we look on the right graph, it's a bit more clearer because we have here the different pathways for our health system in moving towards low carbon pathways. And we can see that we have here low emission area with low performance. This is the number one on the graph. But we have also the green spot, which is basically the area where we want to move, which is the area of high health system performance with low emissions. So then the question is, how can we ensure this high quality of care without producing too many emissions? But what is quite interesting about this is that the WHO also says that there are countries that may have to increase their emissions temporarily to ensure quality of care and move up. But then it's important then to move again to the green spot. So look at this. I really encourage you to look into this because I think it is quite interesting and not straightforward how indicators of health system performance, the overall capacity, and greenhouse gas emission are interacting. Now, to move on, I will share 3 examples of indicators and we will look into this again together. The first one is building a climate-smart health workforce. Now, I want to ask you, which indicators could we use if we look at building a climate-smart health workforce? Imagine you're a policymaker in your country and you want to build a climate-smart health workforce. This is defined by the WHO in the 3 areas of workforce capacity, so education and training. Second, which practices at the facility level take place. And then the third one, information, awareness raising, and communication. Now, please write in the chat 1 or 2 indicators that you can think of that refer to this. So we have here the number of trained personnel, the number with recognized qualification, who has undergone programs, okay? Infection control, prescribing patterns, status of use of plastic, okay. High quality patient care, supply chain, carbon literacy, emergency response plans, okay, interesting. Yeah, waste management. Okay, so we can see here, I can see that you're suggesting a number of structural indicators, but also a number of process indicators. For example, when we talk about waste management in facilities or practices in the facilities, are there any outcome indicators that you can think of? What could be possible outcome indicators here? The outcomes that we are aiming at. In hospital mortality, okay. Immunization, reduction in GHG, change in behavior of staff using plastic. Yeah, but if you think about it, you see that it's not so easy always to define actual outcome indicators, because what is really the end point? Sometimes we will have to deal with intermediate endpoints, and we will then move from there and maybe move to a different piece of our climate resilience cake and define other indicators. Reduction of missed work days, shock event response, knowledge, Thank you. Really nice suggestions. Now let's look at this at one example indicator from the WHO in the domain of health workforce capacity. And I'm just highlighting here two that you've already mentioned, and these are mainly structure or process indicators. So often when we talk about it, we talk about percentages of health workers that receive training, but also curricular changes. But of course, this is not an outcome per se, because we want to achieve other things with that. So I think it's important for you to remember that whenever you talk about indicators, think about, is it a structural, a process, or an outcome indicator? And we will do more exercises now. Yeah, then on the information awareness and communication, one outcome indicator could be awareness among decision makers, but also that there are initiatives established, for example. Let's move to a different section, which is the health information systems. Now, you know that there are 3 sub-dimensions here that I will not go into detail now, but you can look at it in the framework. But let's think of possible indicators on our health information systems. What could be important indicators for the domain of health systems, health information systems? What can you think of? This could be, for example, also from the perspective of a health facility manager. Let's take the perspective of a health facility manager and think of indicators that could tell us whether we, how to assess our performance here. The carbon footprint, okay, the level of carbon. It's also about heat, for example. Degree of waste management, heat-related emissions, kidney damage. Okay, kidney damage, that could be a possible outcome indicator. The question is kidney damage only influenced by climate influences, or are there also other influences like age, socioeconomic status, nutrition? So it might be difficult to link it. Cardiovascular, respiratory diseases, okay? Capacity indicators, early warning system, exactly, yeah. Okay, let's look at what the WHO is suggesting, even though they're not suggesting from the perspective of a health facility manager so much. And there are a lot of indicators that I cannot repeat all of them, but I will again focus on a couple. So within the domain of monitoring and progress tracking, within the first one, the assessment of climate and health risks, we have here, the second, it's monitoring process. Do I have a monitoring process with a clearly defined mechanism for the tracking system to measure progress in greenhouse gas emission reduction? Is it established? Yes or no? This is a yes or no indicator. In a way, it's a process indicator. At the same time, it's a structural indicator. So it's a precondition in a way to start actually action, because if I need to establish first my monitoring system to be able to act. And then another example, establish a dedicated climate change team responsible for coordinating implementation of the climate strategy and monitoring progress across the system, another structural indicator. And I can see that you have more suggestions in the chat, so thank you so much. Now, the third dimension on health systems is on leadership and governance. Why is this important? Why do we need indicators on leadership and governance in the context of climate resilience? That's a top building block within the climate resilience framework. In the WHO understanding, there are 3 objectives. First one is on governance, second one is on policy development, and the third one is on cross-sectoral collaboration. For those of you who come from the health policy area, you will be familiar with the topic of health in all policies or health for all policies. So cross-sectoral collaboration means that we are bringing health to the table of people who discuss climate issues, who discuss transport issues, who discuss water, air, or waste management. So really to bring health to the table, but at the same time also to bring health, to bring to the table of the health policymakers the topic of climate change, the topic of waste management, for example. So we're talking here about this broader vision of a well-being society. Again, if you think of the sustainable development circle with the different colors. So we're really talking about how we can link these different pieces of the puzzle together. But in practice, of course, this is really, really difficult because it means that people will have to give away a part of their funding. It means that they have to coordinate with different actors. They might not get along with the people in another ministry or at another governance level. So in practice, there are a lot of things that can go wrong here, of course. And that's also found when we look into the literature. There's one systematic review that found, for example, that there are several obstacles that prevent, for example, in the area of health adaptation, the implementation, which is the poor policy implementation and evaluation, but also financial constraints, poverty, a lack of commitment, inadequate data, and deficient health systems, especially in developing countries. So we can see that this, on the one hand, the lack of evidence and indicators and evaluation, but also the lack of policy coordination is a big issue in practice. And when we look at the indicators here, we see, and I can see already here some examples in the chat, some suggestions from you. Let me read them. On leadership and governance, are patients involved in the co-design of new policy? Number of successful initiatives integrating cross-sectoral collaboration, horizontal and vertical coordination. Very nice, super, very, very nice. Thank you so much. And here again, we have some indicators, examples, just to also help you understand what this is about. Climate change and health focal points are designated within the Ministry of Health. But that's a structural indicator. It's just a starting point. Another one, a gender-centered approach was adopted in regulations and strategies on climate change and health. That's already more focused on the process. How are we actually moving towards climate resilience? Which aspect do we consider? With whom do we coordinate? Now you can see that for each of these indicators, we could do this exercise. Now, towards the end of my talk, I would like to move to the area of health facilities, which is which I've already touched upon, but maybe also it's an interesting part for you because some of you might be working also in a facility, so you might be more interested not so much in the policy perspective, but the facility perspective. And I'm sure you have also a lot of expertise here that you could share. Just when would we need this? Of course, we think about health facility climate resilience often in the context of acute events. But of course, it's important also to take into account the chronic burden that comes with climate resilience on our health systems that are already under stress, for example, because of staff shortages, poor job quality, etc. Now, the WHO changes the perspective from the system to the facility by including, in particular, the water, sanitation and hygiene and waste aspects, the infrastructure, technology and products, energy, and the health workforce. And we will take a look into some of these now very quickly at the end. Now let's think of a climate-smart health workforce from the perspective of a facility. We already discussed it from the policy level. And what the WHO suggests here is, for example, innovative approaches to reducing greenhouse gas emissions, but also how many people of the workforce participate in decision-making, planning, and management of climate change risks. So do we actually have the processes within our facilities to bring together the administration, the medical staff, the nursing staff, and to think about strategies to reduce emissions. Another one is on climate resilient and low carbon infrastructure and technologies. And what's quite interesting here is when we link health outcomes with climate outcomes. And I have here two examples from transport and from food systems. So the first one here, an outcome that we define: has our health sector transportation system transitioned to low greenhouse gas emissions? So that's really could be an outcome that it's almost like a vision that we are creating for our facility, what we want it to look like. Maybe we have more bicycles, more people coming with a bike, more public transport, etc. Another one is on food, which is to really envision environmentally sustainable low-carbon diets and the procurement of locally produced food, and interventions to minimize food waste. That could be also an outcome that we're actually envisioning here. I can see also that there are some suggestions here: the use of transportation by staff, such as pooled, to reduce emissions, the procurement of culturally appropriate food, also another very good one. So yeah, I can see that you also have a number of suggestions. But then again, if we take the perspective of a person who is, for example, a sustainability manager in a facility, these previous indicators will be at a much too high level for actually operational use. So in some parts, depending on your position, you will need much more detailed indicators, because you will want to have a roadmap and discuss, for example, what is the share of renewables, what is my target, which indicator do I define to actually reach that target, and how can I really get to the end goal of, for example, climate neutrality or low carbon health system from the perspective of a facility. And you will need different indicators probably for the different areas, but also at the different levels here. And the final one, emergency preparedness and management. We saw before the picture of the flooding. It's of course something that is also highly relevant when it comes to the safety of patients and nursing homes in the event of acute weather events. And the WHO defines here the policies and protocol, risk management, and community empowerment as 3 dimensions. And for each of these, there are again indicators defined. Now, if we look at it, for example, we can see that they define climate change-related emergency and disaster response plans for individual health facilities have been developed and implemented. I can see also some more inputs in the chat. So some are saying that cycling to work is a great way to start, selection of the right technology, diets, plant-based diets for patients, staff behavior, transportation and infrastructure, cycling groups. Okay, so I can see that the transport topic is also getting a lot of inputs from your side here. Really nice. So regarding the emergency preparedness, again, we have mainly structural and process related indicators. But that already leads me, but then again, we could define much more detailed indicators if we really want to know whether or not our facility is prepared. The WHO, for example, has also some checklists that you could look into if you look at the area of energy services. For example, what is the level of impact, but also then what kind of actions can I take depending on the impact. For example, is it temporary power supply or a power failure? Is there difficulty in providing healthcare service deliveries, such as dialysis, diagnosis equipment? Do patients have to be evacuated? Do I have reduced capacity to provide disinfection services, etc.? And from this then afterwards, when we talk about the transformation, from each we have to think about what are the actions that we need to take to improve on our performance and transform our system to the better. Now I'm already getting to the summary and the conclusions. And I can see here that some people are writing healthcare professionals and patients can be role models for greener living, very much indeed. More focus on other aspects of environmental impact other than greenhouse gas emissions. Exactly, also biodiversity loss, but also pollution and other planetary boundaries are really important aspects. Thank you so much. annual preparedness simulations. I can see proactive risk reduction. Very nice. Thank you so much. Now moving to the summary and the conclusions. So we saw that the definition of climate resilience includes aspects of transformation and building back better. So this is also how our indicators should be defined. Climate resilience aligns the vision of a well-being society and integrates the different sustainable development goals. But how can we measure it? The indicators are, in general, measurable variables used to assess and monitor particular conditions or trends over time. And we can differentiate structural, process, and outcome indicators. Most of the indicators that we have currently focus on structures and out processes, and it depends always on what I want to do and what is my role. And similarly, the 4 key messages for you: the perspective is everything. The degree of detail in defining indicators for evaluation and monitoring may differ. So are you a local policymaker? Are you a healthcare facility maker? Or are you, for example, a nationwide coordinator? Second, we also saw, we didn't discuss it that much, but when we talk, for example, about the climate smart health workforce, we can see that adaptation and mitigation cannot be separated easily. So we should consider indicators for both adaptation and mitigation. And which outcomes are we actually envisioning and how can we measure them? So really to think more about what are the outcomes that we want to achieve and how can we get there, and which indicators do we need? And then finally, as a reminder, the overall health system capacity matters. How does the staff, how much staff do we have? How is the job quality? Which financing is available overall within the system to finance health systems? And that also determines our climate resilience capacity. And so the overall indicators should be also taken into account. So with that, I would like to leave you with also a paper that we wrote within the European Health and Climate Group before the conference in Budapest in 2023, with 10 steps to measure 10 steps towards climate and health policy. And as a food for thought, I'm giving you this also to think about indicators for each of these steps. But of course, unfortunately, we do not have time now, but I look forward to the case studies and to the discussion. Thank you so much.
Thank you so much, Andrea, for this very interesting lecture. A kind reminder to everybody that if you have questions for the speakers, you can put that in the Q&A box, and we'll have some time at the end. And now we're going to welcome Kim van Dalen for the first case study. So Kim is an environmental epidemiologist and British Heart Foundation Centers of Research Excellence Career Development Fellow at the University of Cambridge. She co-led the Lancet Countdown in Europe for 4 years and was the lead author of the first 2 indicator reports of the European collaboration. And her research interests are on the intersection of environment, climate change, health, and gender equity. So Kim, the floor is yours.
Thank you so much for that introduction, Marie. I'm just gonna double check whether my screen is sharing. Can you see my slides right now?
Yes.
Okay, perfect. Okay. Well, thank you so much for being here, and thank you for Andrea to setting the scene so well. I think I have learned a lot from your presentation as well, so thank you for that. During my next 15 minutes, I will be focusing on the work that we're doing in the Lancet Countdown in Europe to give you an example of some of the monitoring that we do using indicators in the European region. So overall, we all know that climate change is a very complex and multifaceted issue that impacts nearly every single aspect of human health. Think about undernutrition, impacts on mental health, cardiovascular disease, vector-borne disease. I think there's almost no health outcome that we can think of that is not impacted in one way or another by the environment or by climatic variables. And to ensure that health systems are climate resilient and can respond to all these impacts, what we need to do is monitor monitor the impacts of climate change on health systems, as well as monitor the progress, or often the lack thereof, that we're making on climate change adaptation and mitigation. And this includes tracking healthcare benefits. So for example, a lot of the time when we are trying to reduce greenhouse gas emissions, at the same time, we may be improving air quality, have active transport, as well as have healthier diets. So in many ways, having climate mitigation and adaptation is also improving human health. So responding to this need, the Global Lancet Countdown was created in 2015 as a monitoring exercise, and we have been publishing an annual indicator report since that time. And in this indicator reports, we track different aspects of climate change and health from a date as far in the past as we can to a date as recent in the present as we can. And when we talk about indicators here, we talk about measurable quantitative variables that are used to track or monitor trends in climate and health over time. So our indicators specifically need to be available on an annual basis so that we can really see how things are changing, hopefully improving. For most of the impacts indicators, unfortunately not. But we hope that this can then inform decision-making, interventions, and policy. And when we look at our indicators, we roughly divide them in 5 different groups. So we have indicators that focus on impacts, exposures, and vulnerabilities. We have indicators that focus on adaptation, planning, and resilience for health. Indicators that focus on mitigation actions and healthcare benefits. Indicators that focus on economics and finance, and indicators that focus on politics and governments. And in the slides that are following, I will be giving a few examples in each of these different teams. Overall, when we are developing indicators, we have different criteria that we are using. So of course, they need to be meaningful, they need to be relevant for decision making and for policy, and they need to be scientifically sound and reproducible. So they need to be based on existing academic knowledge. They also need to be temporarily representative. So what I mean with that is that we want to go back to a date as far back in the past as we can. So usually that is about 1951 to a date as recent in the present. So for our last reporting cycle, we were able to report up to 2022. They also need to be geographically representative. So for the World Health Organization, so for the European report, we try to include all the World Health Organization region countries, which are 53 countries. But because the data availability is often better for the EU and the UK countries, we tend to mostly focus on them for a majority of the indicators. And of course, the data that underlies the indicators need to be reliable and updatable. When we think about indicator development, there are different data sources that we're using to generate these indicators. So some of the examples are listed here. So when we think about the indicators in Team 1, a lot of them use climate reanalysis products, which is kind of a combination of observational data combined with short-range weather forecasts, and that is then rerun with modern weather forecasting models. So in simple words, it is capturing different climatic factors such as air temperature, humidity, radiation, precipitation, and wind speed. And this is then combined with aggregated population data, put into relevant models, and in that way we can create a range of different impact indicators. But for a lot of our other teams, we will also use survey data, which is often provided by national or local governments to track things as their progress on adaptation and mitigation. We also use a range of natural language models, and this is mostly applied to understand societal engagement with climate change and health. So how, for example, politicians engage with climate change and health if they give EU Parliament speeches, or how the media engages with climate change and health. And we have also a range of different other data that is provided by international organizations, governmental bodies, and academic bodies. So things as air conditioning, how many people in a country have air conditioning or access to air conditioning. But of course, we know that the climate change related health risks are not the same across regions in the world. And therefore, indicator development in the Lancet Countdown is expanding to provide more detailed monitoring for different world regions. So at the moment, we have a region in Oceania, we have one in South America, in Asia, Africa, the small island developing states, as well as in Europe. So for a bit of context of the European region, and this is very unlikely to be a surprise, but we know that climate change is already threatening the health of populations across the continent, and this is leading to an unnecessary loss of life. And of course, as one of the biggest current and historical emitters of greenhouse gases, Europe's response to the climate crisis is crucial both for Europe as well as worldwide. So in 2021, the Lancet Countdown in Europe collaboration was founded, and we published our first publication outlining the scope of our work. Then later in 2022, we had our first indicator report, which by then had 33 different indicators. And last year, we had our last indicator report on 42 indicators. And this included 9 indicators that were not in the previous report, but also includes updates in terms of methodology, in terms of countries that were included, the year ranges, etc. But another thing that we wanted to do specifically in this report is focus more on the equity perspective and also highlight at-risk groups within Europe. However, for a lot of the indicators, this is proven to be quite challenging because often data for specific population groups like women or men or high income or low income communities is not always available. But we have been able to do that for a substantial amount of indicators. We have data for about 42 different indicators. So if we go through all of them, we are still sitting here at the end of this day. So what I'm going to do instead is just give you a general idea of what type of indicators or collaboration has, and then illustrate some prime examples to get a better idea of what kind of methodology is implied and what they roughly look like. So for our first team of indicators, we have indicators that look at different aspects of heat and health. We have indicators that look at extreme events at health. We have a range of different indicators that look at climate-sensitive infectious disease, a range of different indicators looking at allergens, and then a range of different indicators looking at food and water. So this would all fall under the impact type of indicators like Andrea just indicated. All the indicators that are highlighted here on this slide and the slides that follow are indicators that are new in this year's report in comparison to the previous reports. So just to give you an example of one of our heat indicators, we all know that regular physical activity is a key component to a healthy and sustainable lifestyle. But when we exercise in very hot weather, this poses a risk of heat-related illnesses such as heat exhaustion or heat stroke. And faced with that, physical activity is often either suppressed or delayed into cooler times of the day. And if it is suppressed, people may not be physically active at all anymore, which of course increases non-communicable disease risk as well. So in this indicator, we look at how the heat stress risks is changing over different times of the day. And we see very clearly that heat stress risk during physical activity has increased for most hours of the day. If you look here at the first decade of the data, which is the blue line, then the second decade of the data, and the last decade of the data, you see very clearly that heat stress risk is expanding to more hours of the day. And of course, if you look at the European region, the Southern European region was most affected. One of our other new indicators is looking at the climatic suitability for leishmaniasis. Leishmaniasis is a climate-sensitive zoonotic disease that is caused by a parasite and transmitted by female sandflies. And this most commonly results in skin sores, but it can also result in fatality. And we here use a nested machine learning approach to predict which regions, and we call that NUTS3 regions, which are basically small administrative units, are predicted to be suitable for leishmaniasis. And when we look at the figure here, we see that there are new localities suitable north of the historical endemic zones. So the very light pink areas were areas that were only suitable in the first decade of the data. The areas that are a bit more pink were suitable in both decades of data, and the very pink areas were only suitable in the last decade of data. And you see very clearly that there is a range of more administrative units that have become suitable, and it's all a bit more north up to Europe. In our second section of indicators, we have indicators that follow adaptation, planning and assessment, as well as adaptation, delivery and implementation. So we look at, for example, how climate information is taken up in health system, whether there are national adaptation plans for health, whether there are city-level climate risk assessments, and a range of different other indicators. To give an example, this is our looking at city-level climate change risk assessments, and we here see that 80% of 100 of 85 responding European countries cities have conducted a climate risk assessment, and they have identified a range of different health issues that are driven by the climate hazard's relevance to their cities, as well as populations that are most at risk, such as children and youth, low-income households, marginalized communities, women and girls, and frontline workers. Our next set of indicators is focusing on different aspects of mitigation and healthcare benefits. So we look at the energy system and health, as well as different factors of air pollution and healthcare benefits. We also look at sustainable and healthy transport. We look at food and agriculture and health, and we look at the health sector emissions and harms. And this is an indicator that is very similar to the indicator that Andrea just presented. Recognizing that health systems are a substantial source of greenhouse gas emissions and air pollution, and therefore this indicator monitors both the direct and indirect healthcare sector emissions using a multi-region input-output model that is combined with national healthcare expenditure data from the World Health Organization. So we see that in 2020, there was still a substantial amount of greenhouse gas emissions from the healthcare sector, which was a 3% per capita increase if we compare that to 2010, which is quite substantial given a lot of healthcare systems have committed to become climate resilient as well as low carbon. And we also see that regional air pollution related to European healthcare was estimated to still result in about 540,000 dailies in 2020. Our next section of indicators focuses on different aspects of economics and finance, so both the health-linked economic impacts of climate change and its mitigation, as well as the economics of the transition to zero-carbon economies. So ideally, we would like to have more indicators that really quantify on an economic scale what the health-linked impacts are of climate change. But we don't have as many of those yet. But we have things as the changes in labor supply, impact of heat on economic activity, monetized value of unhealthy diets, etc. And then our last theme of indicators is focusing on how different societal actors are engaging with the narrative of climate and health. So the scientific community, individuals, the politicians, specifically focus on EU parliamentarians, corporate sector engagement, as well as media engagement. And one of the example indicators here is the scientific coverage. So if you look at publications on climate change and health in Europe since 2000, we see that there's a stark increase in the information that is being generated. Most of these studies are still on impacts though, and there's not a lot of information on mitigation and adaptation as much as there are studies on impacts. I just wanted to show this as a figure, but I'm not going to go into too much detail. But what is important here is that here we standardized a few of our indicators to give an idea of what the overall trends are if you look across our indicators. And what we see very clearly is that there's an upward trend in health-related hazards, exposures, and vulnerabilities and risks from climate change. We can see that at the top panel, and there's a lack of sufficiently ambitious adaptation and mitigation strategies in Europe. And we see that in the middle panel. We do see some promising developments, for example, reduction in premature mortality related to air pollution. And we also see that there's increased engagement of different actors with the climate change and health narrative. But remember, indicators are not actions. And I come back on that on how we try to translate our findings. But first, the main conclusions of our last report were, of course, climate change is already happening. Is it not a far in the future scenario? Many European countries remain major contributors to greenhouse gas emissions, and a lot of them still provide net fossil fuel subsidies despite the health harms. And failures to take decisive action may exacerbate the existing climate change impacts and lead to missed opportunities for considerable healthcare benefits. And we also highlight that these interconnected health impacts tend to be unevenly distributed among population groups due to differences in exposure, sensitivity, and adaptive capacity. And this often reflects intersected patterns of socioeconomic development, marginalization, and historical and ongoing patterns of inequity. So as Andrea said, indicators don't represent action. So what we are trying to do is find different ways to communicate our science. So I'm briefly going to show you a few slides, and then I'm going to end my presentation. So one of the main things that we've been doing is create interactive visualizations that you can find on the European Climate and Health Observatory to allow different actors to engage with the data themselves. So there are about 15 different indicators that there are all kind of visualizations for that you can find on this webpage. We have been supporting different multilateral organizations and policy bodies with the generation of policy guidance documents. We also have generated our own policy briefs and policy priority documents based on our relating findings, with some of them focusing on specific countries, which have then been led by regional climate and health organizations. We've also developed a range of different indicators. There are indicators, infographics. There are 42 available in English, and the ones in Spanish, French, German, and Italian, I think there are about 10 in each language, and you can find those on all of these websites. We've also been creating country data sheets, so I think we have them for about 14 countries available now, where we have disaggregated the data to a country level so that this can be used by local civil society or local policymakers to inform and have an idea of what the overall climate and health risks are. And that are most of our engagement activities, and hopefully ways that the data can be used or thought about or shared to stimulate action at the end of the day. This is to thank all our collaborating institutions, and thank you so much for the opportunity to share our work.
Thank you so much, Kim, for your presentation. Very nice to hear from the Lancet Countdown. And now we have our third and last speaker, Alina Timotin. So Alina is a specialist in healthcare management, education, and public health with a background in social marketing. As the head of studies at the School of Public Health Management, she oversees the study processes for master students and organizing continuing education program for healthcare managers. Currently, Dr. Timotin is conducting a postdoctoral research focused on infodemic management and digital resilience in healthcare. And throughout her career, she has contributed to the development of courses and educational materials addressing urgent public health issues such as infodemic management, behavior change, and climate change adaptation. Thank you for being here, Alina, and the floor is yours.
Thank you for the introduction, Marie. Hello, everyone. Just a second, I'll share my presentation. Hope you can see it. Yeah?
Yes.
So, good morning, good evening, good afternoon, esteemed colleagues and participants. It is an honor to be here with you today as we explore together how we can work to build resilient healthcare systems. More specifically, I would like to focus today on the crucial role of healthcare managers in promoting health resilience in the context of climate change. First of all, a little bit about our country. The Republic of Moldova is a country situated in Eastern Europe, being bordered by Romania and Ukraine, that has been independent since 1991. Moldova has a population of 2.42 million people as of January 2024. It is located in the Black Sea Basin, a region that faces significant environmental challenges, including effects of climate change. And of course, like much of the world, Moldova is facing significant climate changes. In 2024, for example, the average annual temperature was above the norm by 3.4 degrees, making the highest deviation in the entire observation period. The impact of these changes can already be seen in higher temperatures, more extreme weather events, and increase in health risks associated with climate change. So the shift in climate presents some new challenges to the healthcare system. And according to our law number 74 on climate action, the Ministry of Health is tasked with promoting public health strategies that enhance resilience in sectors critical to health, as well as increasing awareness about the impact of extreme weather phenomena caused by climate change. This law represents a clear commitment to building a health system that can adapt to and mitigate the effects of climate change. And healthcare managers are central to ensuring the resilience of health systems. These professionals are the ones who will be at the forefront of adapting healthcare institutions to withstand climate-related challenges, while also promoting sustainable practices within the healthcare system. So what we do at the School of Public Health Management, we are here to help authorities in this action. Our school was funded in 2003 by the Ministry of Health and Nicolae Testemitanu State University of Medicine and Pharmacy. And over the past 20 years, we have trained about 500 public health managers through the master's program. And also we provide a continuous education for hundreds of doctors annually, ensuring that Moldova's healthcare leaders are equipped with the tools and knowledge they need to meet evolving challenges, in our case, including climate change. So to equip healthcare managers with the theoretical and practical skills necessary to tackle the health impacts of climate change, together with Professor Oleg Lozan, the director of the School of Public Health Management, and Dr. Mihai Pisla, we have designed the Adaptation to Climate Change in Health course at our school. Creating a course involves a meticulous 5-step process, and it usually starts with curriculum development. We define clearly the objectives, select the most relevant topics. Afterwards, we get to the curriculum approval so that to ensure quality and relevance of the subjects. Creation of the materials like presentations, assignments, and other materials needed to support the learning process. Afterwards, we are trying to test the course on a group of about 20 to 25 participants. And also afterwards, we are collecting their feedback through pre and post tests. And finally, we evaluate their satisfaction. In this way, we try to ensure that the course content is improved and refined. And of course, the last step is launching, because we include it into the educational offer. So this iterative process helps us create a course that is both relevant and effective in meeting the needs of public health professionals, especially managers. So each course presents some unique challenges that also come with some with opportunities. For example, the time constraint requires rapid development of the course materials, and this is allowing us to adapt some existing content, such as resources from some other courses. High costs can be mitigated through partnerships, as demonstrated by our support that we get from UNDP in developing this course. In order to engage hesitant participants, we can provide some practical examples, and we try to facilitate group work and case studies in the final assignments, while also digitizing the content for greater accessibility. Also, given the abundance of courses and the busy schedules of public health managers, it is essential to encourage their participation. This can be done by offering some experienced lecturers, focusing on online dissemination, and of course, utilizing word-of-mouth marketing. We have to mention here that we developed this course with UNDP support, and thanks to them, this adaptation to climate change in health course is 25 academic hours long, and is aimed at managers in healthcare institutions like doctors, dentists, pharmacists, and even managers who, without any medical background. And it covers key topics, including the relationship between climate change and health, implementing climate change adaptation in healthcare institutions, promoting sustainable healthcare, understanding the public health risks from climate change, and also climate change communication and how to engage communities in resilience building efforts. The goal of this course is to strengthen both theoretical knowledge and practical skills in managing public health risks related to climate change. We aim to help healthcare managers identify risks, apply risk reduction strategies, and manage emergencies arising from climate factors. So the course has also integration level objectives that include using systems thinking to approach climate-related health challenges, establishing the role of healthcare professionals in the climate crisis, identifying ways healthcare facilities can become more resilient to climate extremes and contribute to community resilience, also promoting sustainable lifestyles at both the individual and institutional levels. By equipping healthcare managers with these competences, we ensure that they are not only capable of responding to the immediate impacts of climate change, but also are prepared to lead efforts to reduce long-term health risks. And of course, our course was inspired by the previous European Climate and Health Responders course. So many thanks to the organizers. About evaluation, we evaluate the course through pre and post tests, usually 12, in this case, 12 multiple choice questions. And also we have a final group project. We conduct a satisfaction evaluation regarding the clarity of study objectives, the difficulty, the relevance for professional development, organization of learning activities, some aspects about lecturers, strengths and weaknesses of the course. Here you can see how the participants' knowledge increased in the post-tests compared to the pre-test. We have an increase of about 2.3 on average. Also, we have to mention that the course difficulty was rated as medium. And the feedback actually has been overwhelmingly positive, with the course receiving an average rating of 9.65 out of 10. Participants have highlighted the relevance to practical work, the structure of the course, and the professionalism of the lecturers also as the most appreciated aspects. As I already told you, they also worked on projects where they selected real-life healthcare institutions and proposed measures to enhance resilience against climate change. This seems to be the part the participants enjoyed mostly. Here you can see some opinions left in the comments of the satisfaction questionnaire. For example, the project was very interesting for us. We worked as a team, each with their own ideas, or the information is very important for us. I now understand that everyone is involved, because they thought previously that climate change is not about healthcare managers and they have nothing to do with it. Another opinion, this course is very important and absolutely necessary for us and the entire healthcare system, because climate change is already influencing our activities too much. Well, in conclusion, the need for extensive training of healthcare professionals on the topic of climate change and health is undeniable. With the increasingly severe effects of climate change, healthcare managers must be equipped with the knowledge, tools, and strategies to protect public health and build resilient systems. The adaptation to climate change in health course is just one part of this ongoing effort, with 126 participants trained between November and December last year. And of course, now available in the continuing medical education offer that of our school. We're trying to raise awareness and to strengthen the resilience of healthcare managers throughout Moldova. As we continue to face the challenges of climate change, our healthcare system must evolve, and healthcare managers must lead the way in ensuring that we are ready for whatever the future holds. So thank you for your attention, and I look forward to seeing the continued impact of this training and inspiring other professionals in shaping more resilient public health systems.
Thank you so much, Alina. And now we'd like to welcome all the speakers back for some questions, and Kirsten will be here as well. So I think we'll start with the first question for Andrea, which is this kind of action framework look like plan, do, check, act approach. Do you think that resilience and quality should be merged?
Sorry, you can repeat the question? Plan, do, check, act?
Yeah, PDCA. This kind of action framework look like the plan, do, check, act approach. Do you think that resilience and quality should be merged?
I'm not sure I fully understand what is meant here. Does this refer to a specific area of the plan, do, check, act model, or I'm not
I only have
100%
this
sure.
on the questions, so I
Okay.
don't know.
I mean, overall, yes. I mean, I do think that it's quite useful to look from both perspective, from the quality angle, but also so that we always kind of try to focus on, yeah, you could call it the co-benefits, so to say, what is good for the patient, but what is also good for climate. I think this would be the ideal way to define the indicators, actually. So in that sense, yes, I mean, it's a very good point, I think. Yeah.
Thank you. And I'll have a question for Kim, or rather, because we have so many questions, I'm just going to throw two at you at the same time. Sorry about that. And they're both about indicators. And the questions are there any important indicators we should be monitoring but currently lack sufficient data for? And how can morbidity and mortality be effectively linked to climate change to develop meaningful indicators?
Yes, thank you so much. I think there are lots of indicators that we are currently not developing yet, and these include specific health-related indicators, such as the impact of heat on maternal and neonatal health. These are indicators we do not have. But we also still don't actually have a lot of indicators that actually track health-related adaptation and mitigation, as well as a lot of the indicators that Andrea was mentioning about actual indicators that actually track health system preparedness and health system resilience. And I think for us, one of our limitations is that because we have to report on an annual basis, that already means that for a lot of the indicators, we are simply not able to do it. It does mean that we have a lot of impact indicators, which is why that session or that team is kind of overrepresented when you compare it with more of the action indicators. For the link in relation to mortality, there are different models depending on the exposure that we're interested in, if we're interested in temperature or of extreme events. So it depends a bit on the exposure of interest and the outcome of interest. But in the Lancet Countdown in Europe collaboration and in the Lancet Countdown collaboration in general, we base our models on what is currently accepted in the academic community. So what is coming from systematic reviews, meta-analysis as the main models. So yeah, everything is academically sound based on the current scientific knowledge.
Thank you, Kim. Alina, I think you have a few targeted questions on the link to the course and a few details. So I'll leave you answer that as well if you have more information there. But the question I wanted to ask you is, how do you measure the impact of your course in participants' action or engagement with climate and health initiatives? Or if you are not monitoring that, how could it be done?
That's very interesting. Unfortunately, we're not measuring the impact of our courses on how to say on long term, or we don't check if they do really implement the what they suggested in their project, for example. Because I told you that we had this real life project, so they were selecting institutions and they presented some suggestions of how these institutions could become more resilient. Unfortunately, the only thing that we do is to test their knowledge before and after the course, and of course what they understood and their satisfaction level. But it would be very interesting to see if they really implement some of these initiatives in their places where they work. I think a very interesting thing is that we have a professional network. Yes, we communicate with our healthcare managers, and I think this is very important to encourage them to send back some initiatives to us so that we could monitor and eventually, why not help them in some initiatives that they have. That would be very interesting. And regarding the link to the course, it is in Romanian, and it's not an open access course, so I don't think it would be very useful.
That's a pity for us now, to be honest, and for everyone here. We're largely out of time, but I'll squeeze another question for Andrea, please. And it would be, if you look at different health facilities, they have different existing health management systems. So how could they integrate climate change indicators into their systems without incurring high costs, given that these upgrades can be very expensive?
Mm-hmm. Yeah, I will answer it maybe first from a climate mitigation perspective. I know that you had a course on health technology assessment. And if you think about the processes at which our health systems are aiming, so what do we want to do with our health systems? We would like to have processes that are that cause as little financial costs as possible, but have a high quality for patients. And then if we manage to include there the environmental sustainability aspects, then that could be a good possibility. So let's say, for example, the example of pharmaceuticals. We want to avoid in our health systems and also in the health facilities inappropriate medication for patients. So for example, too high polypharmacy could be a good example because it produces not only high costs, but it's also bad for our patients. And there, this could be a possibility to say, okay, it's bad for the patients, it's bad for our purse, but it's also bad for the environment. So I think it's important, if you have very little resources, to think where could be indicators that target low value care and help us creating higher value care also for the planet. And at the same time, also, when we think about adaptation, it can be sometimes that I mean, maybe within a hospital, it's more difficult, but if we think about primary healthcare facilities, for example, often social aspects of, linking patients to social activities, it can be, thinking also about social health can be also an important aspect. But of course, it's not so easy to measure, but maybe, yeah, we sometimes need to think a little bit out of the box, I guess. But I saw Kim nodding, so maybe she wants to add something. Yeah.
Nothing to add. I mostly just agree with everything that you're saying. That's just why I was nodding.
Okay, great.
Thank you so much. And I'm afraid we are out of time. So let me just say another big thank you. So first of all, of course, for everyone who took part, but especially to our speakers, to our presenters. It was really great again. And I've run out of slides. There we are. And yes, thank you so much, and see everyone next week. Thank you.
Thanks to everyone. Bye-bye.
Thank you.
Thank you. Bye.